And we're live.
Okay, yes, take two. All right, so we're going to wait for the other people to come up on here. And this is going to go a lot better now that I can hear you, Dr. Eric.
Yes. Anyone tuning in to the new feed?
Yeah, so let us know by dropping a comment. Amber, you can hear us and you can see us and hear us both. Good,
hey,
good.
Kelly's back. Hey, okay. We'll get this thing started here soon, guys. Maybe sometime today.
Yeah, only 10 minutes late here. Thanks for being patient with us. Technical difficulties. Big shout out to Brittany Hull here for helping us fix our technical difficulties without even being present. All right. Hi, Dr. Danielle. Feel free to chime into the comment section here. All right. Okay, looks like we got everybody that was on back on now. So perfect. All right, so we're going to get started here. So I often get asked, you know, as a doctor, and Dr. Eric, I'm sure that you can attest to this as well. We often get asked, like, what's the most important thing that I need to do, you know, to be healthy? And I've lost track of how many times I get asked, you know, similar questions on, you know, what the most important thing is. So I want to take you guys through like a series of logical steps to help identify what the most important things are. You know, some people say, like, oh, like, you know, nutrition and exercise, those are pretty important. Those are really high up there. They're the top priorities for a lot of people. And I would agree they're very, very important. But let's break it down even further here. Because the human body certainly needs good nutrition. It certainly needs good food. It needs oxygen from exercise. But if you think about how long you can go without something like food,
well, I mean, Jesus fasted for 40 days, right?
Jesus fasted for 40 days and 40 nights, right? Like, so you can go several weeks with no food at all. You could literally survive on just water alone, right? So food's important, but as I just mentioned, water is even more important, because how many days can you go without water? Several weeks without food. And then you will perish. Food's important, but you can only go a few days without water before you die, right? Yep. So we can, in the hierarchy of what's important, we can say that water is more important than food, because you can only go a certain amount of days. That's it. If you go past that, you die. But what's more important than water? Well, you can only go a few minutes without air and oxygen. So air and oxygen is even more important than water. If you can hold your breath really long, you might be able to go 3-4+ minutes. But then if you don't take another breath, you die, right? So air is more important than water, which is more important than food. But even more important than air, you can't even go 1 second without nerve supply. So what happens if I cut the spinal cord, Dr. Eric?
I got I think is a good answer. I think you die. Or depending on the level.
if I cut the nerve going to your lungs, can the lungs continue to live?
Absolutely not.
No, right? So nerve supply is even more important than air, which is even more important than water, which is even more important than food. So in the hierarchy of things that you should be paying attention at in terms of keeping yourself healthy throughout your life and maximizing the quality of your life, you had better be paying attention to nerve supply. And it doesn't have to be as extreme as cutting the nerve to, to cause death to a tissue. If I simply put pressure on a nerve, Dr. Eric, since you're the smartest person in the room times 10, why don't you answer this? If I simply put the weight of a dime, now think about this, you guys. If I left a dime in my hand, after a couple of minutes of just leaving it there, I would stop feeling it. It's so light that I wouldn't even know that it's there. But the weight of a dime, Dr. Eric, how much does that shut off nerve supply?
Some of Deed Harrison's work, he's actually proving the action potential of the nervous system and of the nerves that exit the spinal cord. And
whoa. Hold on a second. I told you guys, Dr. Eric's the smartest person in the room times 10, but even for people like me, you're gonna have to come down and speak in layman's terms. So action potential and whoa. So what are you talking about here?
Action potential is a simple way of putting the communication through the nerve.
Right. So communication. So the nerve transmission. The brain's trying to talk to the body. It sends a signal down the nerve, and the weight of a dime on that nerve is enough pressure to shut. How much?
70%.
70% reduction in nerve transmission with the weight of a dime on it. Now, that kind of pressure happens when the spine is out of alignment, shows the research. You were mentioning Dr. Deed Harrison, who's published over 100 peer-reviewed studies on the biomechanics of the spine and the effects on the brain and nervous system. And some of my favorite studies of his show that when the spine is out of alignment, when you lose that natural curve in your neck, that indeed that nerve transmission that's trying to get from the brain to whatever other organ those nerves are trying to get to is reduced as much as 70%. And so think about that in terms of your own health goals and how long you want to live. And for myself, I want to live past 100. I'm sure it's the same for you. We want to leave a long legacy of health and vitality. So the number one thing that I take care of on a daily basis before anything else is my nervous system.
It looks a little bit like this, right? You go back and forth.
Right. So it's all about maintaining the integrity of your spine because of the nervous system that lives inside of it. And that's where we get to the importance of chiropractic care. That's why it's at the core of everything that we do. Our 5 essentials health delivery system, as you've learned over the last 4 weeks. The core of it is really chiropractic care because it is the system that helps to take care of your spine and nervous system and maintain the health of that. So let's just go back to the slides here. And I want to just kind of define what chiropractic care really is. So, chiropractic is going to help you achieve lifelong health and wellness. And it really starts with your adjustments. If you go to the Max Living website, you'll see the definition of chiropractic care a little further here and how it's central to your health. So I'm just going to read it right off the website. So spinal correction is at the core of chiropractic care. Your spine is your body's central information highway, and proper spinal alignment aids in maximizing the nerve supply. And this is important in maintaining effective nervous system function, and it unlocks the body's natural potential for optimal health and improved physical ability. So let me just go back to the other slides here. Okay, I can see you guys again. I had just taken myself off. All right. So when it comes to the integrity of the spine and how it affects the nervous system, well, that starts right at birth. The very first trauma that's been shown to occur to the human spine is usually the birth process itself. And so if you ask my opinion
especially if I can interject here, especially if it's a quote unquote traditional hospital medicalized birth, there's so much interference, again, going back to the core philosophy of chiropractic is the truth about it from the core is all we want to do is remove the interference of health and let your body just brilliantly shine. And that's really the basis of what we do is, our bodies are made perfect from this birth. And it's us that interfere with that life expression, that health expression that we get to have or not have. So like it really just starts from the beginning, like Dr. Steph was saying.
So like going back to how the brain controls everything in the body, and it does that through the spinal cord, which is protected by the spine itself. For your heart to beat, it requires your spine to be in proper alignment because the brain cannot send the signal down the nerves that go to the heart properly if there's any kind of pressure. For your lungs to breathe normally, for a cut to heal on your leg, the brain has to send a signal from up here, send it down the spine and out the spinal nerves to every cell, tissue, and organ in your body. So we all know what happened to maybe if you're 20 and younger here listening, you might not know who this guy is, but we all grew up idolizing a guy named Christopher Reeve because he played Superman. And we always go back to his story because it's such a clear example of how important the spine and spinal cord are to the function of the rest of the body. So we all know what happened to him. He fell off a horse and he broke the very top bone in his neck called the C1 vertebrae, the atlas. If you look on his x-rays, all you can see is that the atlas was shoved forward, by a few millimeters. That's it. That's all it took. And everything below that atlas shut down. His heart couldn't beat anymore on its own. His lungs could not breathe on its own. All the tissues below the neck were dying. And he was on a machine, on life support, until he eventually died. That wasn't even enough to keep him alive. He had no quality of life. The nurses had to push on his digestive tract for him to have a bowel movement after he was tube fed. Nothing in his body worked after the interruption to the signals in the spinal cord, and is because of the disturbance in his spine. So in chiropractic, we call that disturbance in the spine subluxation. So if we go to, let's go back to the slides here so that everyone can see a little bit more about what subluxation looks like. So if you look on your left of your screen here, you have an example of vertebral subluxation. So you see a spine, you see the nerves coming out of the spine, and you see that one segment in the middle where the red disc is. It's it's misaligned. It's not in its proper position, and it's now interfering with the signals coming from the brain and out those nerves.
And we're talking millimeters of misalignment here. We're not talking huge dislocations of joints or anything. This is tiny millimeters of misalignment will cause this irritation to the nervous system. Sometimes
it's as simple as just a stiff joint, a joint that has become stiff. It's not even that it's misaligned. It's just that it's not moving a whole lot. And then you got a pooling of fluid around those nervous tissues that put pressure on the nerve that way. There's so many different ways that subluxation interferes with what your brain is trying to do in terms of communication with the rest of your organs and your organs back to the brain. So the number one thing, when you look at the 5 essentials of human health, if you don't have proper nerve supply, you can throw out everything that you've learned in the last 4 weeks. You learned a lot of good things about detox last week. You learned a lot about how to feed yourself for maximum health through pure and simple nutrition. Dr. Mark gave an amazing talk on reversing chronic disease and maintaining your health through nutrition. You learned a lot about exercise from Amber and Courtney to maximize like hormone-based fat loss and increasing, your physical state through exercise. You learned about mindset and how important that is to reduce stress, how that robs you of health. But if you don't get this one concept right here in front of your screen here, vertebral subluxation and your ability to eliminate and reduce vertebral subluxation throughout your life, completely ignore the last 4 weeks. You can throw it out the window because it doesn't even matter. Hey, so Dr. Eric, let's go back to the example of Superman. Or anybody that has reduced nerve supply, but let's use Christopher Reeve in his paralyzed state because he had no nerve supply. Did it matter if I fed that man the most perfect diet possible? Would it have restored his health?
Nope. Not a chance.
If I, I'm sure all of the amazing team of rehab specialists that helped work on his body to just maintain some viability of those tissues, would it have ever brought him back to being able to walk again and to be healthy and strong?
No amount of exercise will fix a cut nerve.
Right. So, if I eat, nothing but organic broccoli every day and I start every morning by doing 100 push-ups, none of it matters if I have vertebral subluxation interrupting the messages coming from my brain down the spine and out the nerves to all of those other muscles, all of those other organs. If there's any kind of weak signals and interruption in signals, and that's what we call subluxation, if there's any of that going on, it doesn't matter if I eat organic vegetables or do my exercise, because this is still going to rot over time, increase the amount of interference, and eventually it's going to be so degenerated that I will lose all quality of life. And we're going to show you through the research in a few minutes here why somebody loses their quality of life, even if they eat a great diet, even if they're the fittest person if they're not taking care of this, they still rapidly end up losing their quality of life once the degenerative processes of the spine start to catch up with them. So why don't we just move to the different stages of spinal degenerations, and you can see it on the x-rays here, the progression of what happens here. So I want to blow this up as large as I can here, and then I'll have Dr. Eric just kind of guide you through the different phases of degeneration here and what happens, why this is so stinking important to take care of. And if you ask me, from birth on, the sooner you start, the better your chances at preventing this decay from happening. So take a look at that first normal curve on the left, and if you'll comment on that curve on the left and then take them through the different stages, since you're 10 times more intelligent than me. But remember, speak in terms that everyone will understand.
Okay, so the stages of spinal degeneration. So we develop these normal S-shaped curves. If you're looking at you from the side, so that X-ray we have you take and you put your arms up like this. We're looking at the lower back and we're looking at ourselves in the mirror. That's the picture that we're kind of looking at with these x-rays, is from the side. And your spine needs to have these normal alignments, just like a normal blood pressure, normal heart rate, normal temperature of the body.
Do you have a spine with you?
I can grab one real quick.
Yeah, so I'm going to talk more about this slide here. So while Dr. Eric grabs a spine here from the clinic, I'm at home here. If you start on the left here, he was talking about a normal S-shaped curve. So I want him to show you on a spine exactly what that looks like from the side. If I turned you from the side, it's normal to have curves. It's not normal to have curves if I look at you straight on. It obviously should be straight up and down, shoulders level, hip level. But it's from the side. And this chart that we're going to show you shows a person looking to the side, and you should have a nice banana-shaped curve here that Dr. Eric's going to demonstrate on the screen here. So go ahead.
Okay. So this is the banana-shaped curve.
Yeah, explain that, like what direction they're looking at here.
So this is your spine from the front, like Dr. Steph was talking about, should be straight up and down. Looking at the side, like looking at me turned, facing to the other side. Spine should be curved just like this. It's got a normal S shape curvature in the spine, and that's a normal position. Now, something I want you to take a look at here, these little sponges here, you see that? Those are your discs. That's the shock absorber. It allows movement of the spine. It kind of separates the bodies, and it really allows us to be the dynamic, movable human beings that we are, is partially involved with the disc. Now, there we go. Get it back in the view here. So
everyone's heard of somebody with a blown disc, like they blow out a disc and, they're in terrible, terrible pain. So it's those little spacers between the bones that you want to keep nice and thick and well hydrated. So that's what Dr. Eriks was talking about there. Go ahead.
Yep. Thank you. So when you're in a normal alignment and you have this C-shaped arc here, take a look. So if gravity is pushing down this way, where do you think most of the load or most of the weight of your head is going to be in this position, Dr. Steph? Over the discs or over the bone with your neck in this position?
Yeah, so the weight of your head should be on the back part of that arch, the back part. So the back part of the spine is the strongest part of the spine, is on the back part of your spine. So now if we go,
the most common thing. So we all think of spinal problems being this large scoliosis or this huge curvature of the spine, right? And that's obviously not good for the reasons that we've discussed already. But what we don't see a whole lot of people walking in like this. What we do see is people walking in with this sort of posture, with a loss of that normal curvature. You see how straight that is? And it's kind of like this rounded position that most people are in on the computer or at the chair at home or at work.
As I pull up as everybody at home just sat up and pulled their shoulders back because this posture is what you're talking about, which we're gonna show you some research on why that's so detrimental.
But
so everybody hold your shoulders back.
Just from a mechanical standpoint, this forward head posture, look what happens to those discs now. You see it right here.
Can you put that closer to the camera so they can see what happens to those?
I don't know if that's visible.
Yeah, some of those segments you can see how thick they get when you've got that normal arch.
Yep. Here's the normal. Look at the little cushions in there, and here is that loss of normal curvature. You see there?
Yeah, so I can see that those segments in the middle, you can't even see the discs anymore when you lose that curve. You get completely compressed. And then what does that cause to where those little yellow nerves on your spine model? What does that cause to the nerve exiting in the back when you lose the height of the disc, when you lose that curve when you're bent over?
So this little hole that these nerves come out, that's the intervertebral foramen. This hole closes down or gets smaller when you lose the normal disc height. So that compromises the nerve just in itself. But then, like Dr. Steph was talking about earlier, when you lose normal mechanics or normal movement of the spine or any joint in your body, really, it brings inflammation and swelling to the area to heal it. It brings nutrients to the area because there's damage there. And that swelling that comes in can also irritate the nerves and irritate the joint and start the decay of the joints of the spine.
Did you just use the term intervertebral foramen? I can barely say the word. I just you see that hole where the nerve exits, right? So as you can see, Dr. Erik is an uber nerd, and that's why we love him, because he's just so full of knowledge here. But yeah, just to keep it really simple, it's like the hole. If the hole where the nerve comes out is shrunk, well, it's going to put pressure on the nerve, and wherever that nerve goes. The research shows that whatever's at the end of a damaged nerve dies early. Mm-hmm. So let's go back to the stages. Talk to them about the stages of degeneration here. Where which they can all see on their screen right here. You start on the left there with a nice banana-shaped curve. You can see a person looking towards the right.
Yep.
And then over time.
So the stage 1 subluxation degeneration is that loss of normal curvature in the neck, that loss of that banana-shaped curve. And you can see that in stage 1, it's very straight, loss of that curvature. The black line is depicted as like the normal, but you can see how straight the spine is at that point. Now, when that happens, stage 1 is the start of, for a pretty grim look at it, it's the start of the end if you don't start working on getting this corrected. And unfortunately, we're seeing this more and more common, even in younger kids. And then, so when you lose that normal curvature, it stresses the spinal cord. It actually stretches it. The research has shown about 7 to 10 centimeters once we start to lose that curvature. And then moving into stage 2, we've been there for so long that now we've got bone spurs and degeneration of the disc starting to develop. A lot of joint stiffness is experienced in people that are in stage 2 of that degeneration of spinal, the stage 2 of spinal degeneration. Stage 3 is just a progression of the decay of the joints. The discs, if you can kind of zoom in a little bit onto the picture on your screen on the other side, you can see that there's large bone spurs coming off of the front side of those vertebral segments. And then stage 4, we honestly, we don't see a whole lot of people into that stage 4 because their spine is so rapidly degenerated at that point that their nervous system is severely compromised. And that this here, the people that I've seen in stage 4 have not been doing well, either in nursing homes or not, like, bedridden, not able to move around and do much. So it's absolutely critical to get these things checked to see where you're at. Now, the spine is such a complex organ system, neuro organ system. That's a fun word to say. That, like, over the years, it for some of these more complex structures, it does take a long time to fix. But so
you bring up a good point there. So, like, you called it a neurospinal organ, and so one big misconception here before we get to like showing you guys me and Dr. Eric's favorite research on chiropractic and the amazing benefits of it is that you called it a neurospinal organ. It's a big misconception to think about the human spine as a separate entity from the brain and nervous system. It's simply not the case. They have such an intimate relationship. They're so connected. It's more proper to think of it as one neurospinal organ. One affects the other. If you lose around my shoulders, if you lose the structure, you lose the function, pure and simple. In nature, you cannot find me a single example of anything that when you change the structure of it, the function also changes. So you and I, Doctor, we're getting more and more into the idea of maybe becoming, like hobby pilots one day when we're a little older and flying airplanes. What would happen if I change the shape of the wing of an airplane that creates the lift and keeps it in the air? If you change the shape even a little bit, what happens to that plane?
You don't want to get in it.
It falls out of the sky. The function changes, right? If I have a 4-legged chair and I change the shape of it, I take off a whole leg. What happens to the function of the chair? It doesn't work anymore, right? So in nature, you can find examples everywhere you look. If you change the shape of something, you change its function as well. And the spine is no different. It will negatively impact the function of your brain and nervous system, and therefore the health of every single cell, tissue, and organ once you have let that spine degenerate over time. Shelley Horton has a great question here. So in stage 4, once everything is fused together, there's no more disc height, arthritis has completely fused the spine. She's asking, is there no help at all? It's not true. We can't correct the shape of the spine anymore. Once you're in stage 4, we're not changing, we're not correcting the spine. But there's a lot of research and of course the testimonials from our patients and clinics around the country do show that even somebody who's got a spinal fusion, whether that's a surgical fusion or a degenerative fusion, like you saw on the chart. If I can go back to that. There you go. So if you go right to the right, stage 4, that person we're not correcting the spines anymore, and there is a tremendous amount of pressure on their nervous system. But by simply stimulating those joints that are fused through the tools that we have, by giving them very light force adjustments, you can still, and this is proven on brain scans, on CT scans and MRIs of the brain, you can get those nerves to fire better by simply giving somebody a chiropractic adjustment. So there's, Shelley, there's always hope. So if you know people that have had spinal fusions, if you know people that are severely degenerated, like we adjust people in their late 80s and even 90s in the clinic, and they report feeling healthier, feeling better, having more energy, being less stiff, even though they're in the late stage 3s and stage 4s for some of them. So there's always help.
Has a huge potential and possibility of improving their quality of life. Like just this week, we've got a couple older people that are getting adjusted, and I heard that, hey, just so you know, I'm able to stand in front of my kitchen sink and do the dishes without being excruciating pain. Hey, just so you know, like I can actually reach my arm up overhead and grab something out of the shelves now since I started getting adjusted. Like things like that we all generally healthy, we take for granted because we can just do it. You know, we're healthy and mobile. But as you age, if these degenerative processes really take over and you're into that stage 3, stage 4, like Dr. Steph said, we're not correcting their spine, but we can improve quality of life. So making their day-to-day be much healthier and feel better, feel more energy, sleep better. You know, those things go a long way for someone in their 80s and 90s, even 70s that has lost some of their mobility and independence. Chiropractic care is huge for those people.
Yeah, I know for myself, if I could share a little bit about my own story. For people that don't know, I come from a family of well over 40 chiropractors in my extended family, and most of the members, that second generation, you know, in our family, we've been adjusted. Our spines have been adjusted and checked since the minute we were born to reduce. Let's go back to the to reduce vertebral subluxation. That thing you see on your screen right there. We were checked for vertebral subluxation minutes after we were born, and it's been our healthcare delivery system essentially since we were born. And there's over 100 members. We've all lived this way. We've never been to a medical doctor ever once in our life, and it's because of this incredible thing called chiropractic care that's kept us I would say far healthier than the average person out there. And because we always try to maximize the nerve supply coming from our brain to the rest of the body and the body back up to the brain by reducing vertebral subluxation. So it's been this tremendous benefit that I've been able to live. I'm in my 40s, and I still feel like I'm in my 20s because I just pour into what you guys have learned are the 5 essentials of human health. And with daily practice, daily application of these 5 essentials and making chiropractic care the core of all of that, you as well can experience the best health you ever have, no matter what stage you're at, whether you're you have a perfect spine, or you're in stage 1 where you've lost the curve, you're in stage 2 where arthritis is starting to show up on your x-ray. Or like Shelley mentioned, if you're in the later stages, you can improve your quality of life by applying the 5 essentials. And Dr. Eric, would you quickly just you have such an amazing story about how you found chiropractic, because you were not from a family of chiropractors like me. You have a different kind of like entry into chiropractic care. Can you tell them like what your life was like before chiropractic versus what it is now?
Completely different.
Give us like the 2-minute version.
First I want to say, yes, Dr. Steph really is 40. 41, 42?
Yeah.
40?
Yeah, 41.
So 40 something, whatever, it doesn't matter. But so he's right now the oldest person that works in the office, but he looks like he's the youngest. So this is what chiropractic care can do for you. So,
well, it's the 5 essentials. It's 5 essentials applied over a lifetime, and it's daily practice. It's daily practice.
That was a bad joke. That was a really bad joke. Okay, so
yes, I'm the old guy. Thank you. Yes.
My chiropractic story started like a lot of people's, honestly, man. I was in the peak of my physical fitness, 19 years old. I was studying exercise physiology. I wanted to be a PhD exercise physiologist. And basically what I did was after somebody had a cardiopulmonary event, I would help develop a rehab program to bring them back to their daily life. And in working with people like this, like it gave me an insight into the true medical system and like the flaws that are in there. But then about that time, as I'm studying the physiology of the body and how the body works and how to exercise appropriate and all this stuff, the worst thing at that time in my life, it actually ended up being the best thing that could have happened to me, is I was weightlifting and I snapped, something popped in my back. And instantly my leg went numb. I had to like crawl over to the bench and sit down. There was excruciating pain in my back, right above my tailbone. Felt like I was literally being stabbed with a hot knife. And after a few weeks of just rest, it kind of got better and subsided. I was real stiff and sore for probably a year. And then after that first year, my back would start to go out. It would just, I call it, the only thing I can say is it would go out, right? And some of you guys can relate to this sort of pain where like I literally couldn't get off the floor some days. And I was in college, again, in the peak of my physical fitness. I played 2 years of college soccer. I was weightlifting regularly. I was eating healthy, like all of this stuff that I knew to be healthy. I was doing it all, right? Except for I had no idea about chiropractic. And so fast forward a bit, about 3 years. So I was 23 years old and my back was getting progressively worse and worse and worse. And it got to the point where in college, I was about a year from graduation with my bachelor's degree. And my back went out and I literally missed 2 weeks of class. I was about to fail out of some classes because I couldn't make it to class. My instructors were getting upset. And I literally had to call my roommate. He had to come back from his class and help me off of the floor so that I could use the bathroom. And that was a defining moment for me because like at 23 years old, I'm physically fit. I look healthy. I feel healthy other than this pain that I'm having. And I can't get off the floor. So like all of this came to a head at that moment. And as I'm crying on the floor, waiting for my roommate to come home, I'm just praying like, there's got to be something else. I've tried PT. I was on drugs, Flexerol and Oxycontin for years. None of that stuff was working. It just allowed me to basically get through my day. And then I had a friend that she, at this point, had to drag me into her dad, her brother, uncle, kind of a family like Dr. Steph's in chiropractic. And I literally got dragged into an office and I couldn't walk when I was helped in. I was leaning over because of the pain. And I got one adjustment and it was like turning on the light switch. I was instantly a huge reduction in pain. And then over the next few months, I was getting adjusted three times a weekend. I would go home with her every weekend and get adjusted. And something really cool started to happen about 4 or 5 weeks in. So about 10 adjustments. Something really cool started happening, and I had no idea that it was related. I never told my chiropractor or her dad that I had crazy digestive issues ever since I can remember. Like, I was in high school, I was going in between every class change. I was going to the bathroom before class, after class, when I woke up in the morning, before, like it was 10 to 15 times a day I was going to the bathroom. And I thought that was normal. I ate well and I did all the right things, but I was still doing it. So I thought it was normal. I have healthy bowel movements. I go 10 times a day, and what changed is the frequency of bowel movements. So like I went from 15 times a day down to like 8 or 9. And then it kept on getting better and better and better. I also had acid reflux that started to get better. So I'm like, the only thing that I've changed is I started getting adjusted. So I started hammering this guy. I'm like, what are you doing for my stomach? Because I haven't changed anything, and I just started getting adjusted, and now I'm having, I guess now, regular bowel movements, right? And that's when the chiropractor, the doctor, he said, come over here, let me show you something. And he pulled up my x-rays, and at this time it was on the old view box, the white box on the wall with the light and everything. So he put up my x-rays, and he showed me my hips were off like this. So I had almost 20 millimeters, almost a full inch difference in my hips, and I had a curvature in my spine. So my spine in the lower back, when I first started, looked like this. Not good, not good. And he said, look, it's very simple. Your spine protects your nervous system. It's like armor, right? And when the spine shifts, it'll cause pain, it'll cause discomfort, lack of mobility, stiffness. But the thing that you don't realize is that these nerves also control right around on the other side of the spine, those organs that are keeping you alive. And in your case, the nerves that are being pinched are controlling your bowels. When we start to remove that pressure, your body's going to heal. I fully expect you to have normal bowel movement. That's what he told me. And that was the first time in my life that anyone had ever been able to look me in the eye and say, I know exactly what's causing your problem. All we have to do is work on correcting the structure of your spine and remove that interference, and your body's going to heal and function normally again. And, fast forward another year or 2 years of chiropractic, that first 2 years for me, I'm not going to lie, it was pretty miserable because my back was still going out constantly. And you guys that have been patients for a little while, you guys know that I've had a couple flare-ups with my back. There's
so you're saying it's a process. It didn't just like heal overnight. There was a process of healing that had to happen. But I think the important thing that you mentioned is that you finally, after years and years of having those other health issues that you never even told your chiropractor about, like severe digestive issues, severe irritable bowels, and you never got some answers for your whole life. All of the medical visits, you never got the answers. And I think this brings up such an important point. And I want you, before we end this, and we're gonna cover some of me and Dr. Eric's favorite research on chiropractic care and the nervous system. But before we go there, I want to just spend some time on this point here. There's a massive difference between going to the medical doctor, looking at what symptoms you have, and walking out with a drug for those symptoms with no answers as to what's causing it, no plan on coming off of the medications in most cases when you get a prescription. And so it just highlights the difference between the two approaches, the two philosophies, in other words.
Yep.
It's been one approach.
One of the chiropractic mentors that I've had, actually, no, this is a quote from B.J. Palmer, the developer of chiropractic. He's the medicine is the study of what causes a man to die, and chiropractic is the study of what causes a man to live. And that's the difference that Dr. Steph is talking about. It's a completely polar opposite way of thinking about health.
Completely. So one whole system, that the system that we're currently living in is simply geared towards managing symptoms through chemical drugs and surgeries. And that's the large majority of what you're going to have throughout your lifetime. If you just stay in that system alone, it's going to be symptom management. And on the other side, you have families that their primary care provider is a chiropractor, kind of like my family. I don't think people understand that, like the physician level training that chiropractors have, and that your family, your primary care provider can be a chiropractor. And what the difference that you're going to get is that you're going to actually get a doctor that's looking to adjust the actual cause of the issue and fix the causal factors of why you're sick, instead of simply masking the symptoms with a drug, which is why chiropractic is at the core of everything we do on our healthcare delivery system. There are a lot of health essentials, like we covered in the last few weeks, but unless you fix the actual cause, fix the nervous system, and then address the deficiencies, you're going to have symptoms, you're going to have dysfunction for the rest of your life, and it's just going to spiral out of control, like we unfortunately see in our current healthcare system. Some studies put our healthcare system anywhere between the number 3 and the number 1 cause of death in this country. That's insane. Our very own healthcare system, the way it's practiced. And that's because there's just no emphasis on actually finding out what's causing these issues and treating the cause versus just managing the symptoms with a whole bunch of dangerous drugs, which unfortunately have a whole lot of side effects and cause a lot of death and destruction. So chiropractic as the primary care provider, that's the way I'm going for the rest of my life. I've seen the proof with my extended family on the difference in how healthy we are compared to the average person. And so let's wrap things up, Dr. Eric. I've got a slide here about, I've written down, like some of our favorite research topics in chiropractic. We could spend a week combing through the hundreds and hundreds of research papers that show how your body performs so much better after a chiropractic adjustment. But let's just highlight some of the my favorite ones, your favorite ones here. So we'll just like rip through the list here and send everybody off with a whole bunch of hope. And yeah, go ahead.
Oh, I was just gonna say there's one that is really good that I'd like to start with. It's emerging research. People might have heard of this before. Heart rate variability. It's a new measurement that they're taking for health indications, kind of like blood pressure, cholesterol, or heart rate. So this is called heart rate variability, and this measures how well the heart adapts to changes and challenges. So like, say you get out of your car and you walk a block to the supermarket, and then you're hurrying around and your heart rate is elevated because you're in a hurry and you're running, and then you go home and you run up the stairs of your apartment and you go into the house and you're running around. Your heart rate is normally going to be elevated to keep up with the demand of your body, right? So this measurement, heart rate variability, your heart should adapt to these changes. So and that's managed through your nervous system, a balance between the sympathetic or that fight or flight side of your nervous system, like you're running from a bear, and the parasympathetic or that rest, digest, and healing side of the nervous system. So having balance between that system is essential to have healthy heart rate variability. Now, they're
saying, if I could just jump in there, like heart rate variability is the number 1 predictor of whether your heart is healthy or not. It's the number 1 factor of whether you have a healthy, functioning heart and nervous system. They measure heart rate variability. How well does it adapt to varying conditions? How well does it adapt to stress? And
I think how quickly it goes back to baseline normal heart rate after the activity is done.
And so, like, does the study on heart rate variability show that a chiropractic adjustment improves heart rate variability, or does it not?
It improves heart rate variability.
Boom. The number one factor of whether you have a healthy heart and nervous system is heart rate variability. And there's more and more and more studies on the autonomic, the automatic nervous system, like the part that you can't control your nervous system. It improves heart rate variability. Let me go to the list of studies here so that they can see like a quick overview of my favorite things, your favorite things. Heart rate variability study is on there. So me and Dr. Eric put together this list here, and my favorite research studies touch on these topics here. Research shows that a chiropractic adjustment affects the autonomic nervous system. So that's the kind of like the nervous system that you don't have control over. It's the one that sends messages to your heart. It's the part of your nervous system that you cannot feel. That I'm squeezing my hand right now. I'm controlling this through thought. That's not the autonomic nervous system. That's a different branch of your nervous system. So it's the signals that go to the liver and tell it how to detox and produce enzymes. It's the part of your nervous system that controls your digestion and your stress hormone response. Chiropractic research shows that it has a massively positive effect on the autonomic nervous system. And given that all chronic diseases are rooted in a dysfunction of the autonomic nervous system and the overproduction of certain stress hormones, getting a chiropractic adjustment to regulate the autonomic nervous system and balance all of those hormones out is one of the most important things that you'd possibly do for your health. So I love all of the research that touches on the importance of a chiropractic adjustment and how powerful it is at affecting the autonomic nervous system. Research next on the list, Dr. Eric, you've been following Dr. Heidi Havoc's work for a few years, as have I. She has demonstrated time and time again how an adjustment affects parts of the brain. You look at the brain on a scan, before adjustment and after, that scan lights up, and especially certain parts like you'll see on the slide here, the prefrontal cortex, which is your decision making. It's how you interact socially with the rest of your world. It improves the function of that part of your brain. It's phenomenal what happens to the brain when you get a chiropractic adjustment. So would you say that, chiropractic is more suited, or more best described as, kind of a method to help reduce pain in the musculoskeletal system? Or would you say that chiropractic is really what it really is all about? It's all about the brain and its health.
It's all about the brain. I mean, obviously,
it's all about the brain.
Obviously, it helps with spinal conditions and pain because when you have dysfunctional motor units or dysfunctional joints in your body, it's going to cause stiffness and pain in these things. So yeah, you reset the joint mechanics or how the joint works, and pain is going to go away. But oh my gosh, it's only a fraction of what the spine actually does in the big picture of how your nervous system functions when the spine is shifted out of alignment. It's
right. So there's just mountains of research on the kind of like the musculoskeletal conditions and how chiropractic helps improve things like pain levels and muscle recovery and all of that. But man, I love to geek out on how chiropractic affects brain health. Next on the list of some of my favorite stuff that I've read, it's like chiropractic affects your serotonin levels. Unbelievable. So, mood and insomnia and things like that. Next on the list, like you want better sleep, you better have a healthy spine to start with, and then add all of those other healthy habits. Blood pressure. Landmark study out of the University of Chicago showed that a very specific chiropractic adjustment to the top bone in the neck was more effective at reducing blood pressure than 2 of the top blood pressure medications given together. It's unbelievable what happens when you just kind of remove interference to your central nervous system through a chiropractic adjustment, which proves time and time again that health cannot and ever will be achieved from the outside in. You already have health inside of you. It's literally just being prisoner. It's a prisoner of a malfunctioning spine and nervous system at the very root of it. So you unlock what we call subluxation. You improve health from the inside out, and you just watch the body heal. Countless patients day to day I get, and same with you and the rest of the doctors in the office. We're so blessed to go to work every day and hear the stories of all of our patients, how they're healing, how they're functioning better, how they're sleeping better, how hormones are balancing, et cetera, et cetera. And it's because you already have the health inside of you. We're just helping to unlock it. Heart rate variability is there on my list is the next thing. Oh man, the immune system. We could go on for a month talking about these studies on the immune system, but just touching on, like, remember the last pandemic? We're in the middle of a pandemic right now, which personally, this is my personal opinion based on the research that I've seen. Just to go off on a tangent just a little bit, I am 0% worried about this pandemic, and that's my own personal kind of like stance on it right now for myself and my body and my immune system, based on all the research that I've seen. But I put a lot into keeping myself healthy, right? So I don't walk with fear. I don't let the news scare me. I have not stopped living my normal life because of the amount of confidence that I have in my own body's immune system. And whether you go back to the last world global pandemic, the 1918 Spanish flu, you'll see that people under chiropractic care versus people under medical care, there was a stark difference. I have this study right here. Guys, you got to check out these numbers. Like during the last pandemic, you want to know, like, coronavirus. You want to know what your best bet as to keeping healthy. It's the 5 essentials, and here's why. And starting with chiropractic care, during the last pandemic, 1 out of every 15 patients under medical care was lost, and this is a pandemic that killed millions and millions of people across the globe. And in the U.S., when they studied it, 1 out of every 15 patients under medical care, died, versus 1 out of 866 patients that were under chiropractic care. That is a stark difference.
Say that.
1 out of every 866 people under chiropractic care succumbed or died of the Spanish flu, versus 1 out of every 15 under medical care. So you want to stay healthy? You want to stay out of harm's way? I mean, this is my opinion, of course. Have a chiropractor as your primary care provider, and helping guide you towards better health and away from disease, away from unnecessary drugs and surgery. That's just the way I've lived my life. And I'm encouraging all of you to have a chiropractor as your primary care provider. You can always include medical care when it's necessary. Like, there's a time and a place. If I'm in a car accident and I'm bleeding out, I'm not going to the chiropractor. I'm going to the hospital, where they are the number one in the world. We have the best healthcare system in the world when it comes to emergency medicine. But when it comes to preventing disease, when it comes to improving people's health outcomes, when it comes to improving the immune system, chiropractic has got it. It's not even a competition. It's not even a fair competition. So we don't even have to really get down into the actual numbers a whole lot, because it's not even a fair comparison. Next on my list of my favorite chiropractic studies are other things about the immune system, where you show things like the immunoglobulin production that the body has after an adjustment, and it just spikes. Your immune system spikes after an adjustment. So I never, ever miss. Listen to this, guys. I never, ever miss my weekly adjustment, because I want to keep my body strong. I want to keep arthritis at bay. I want to prevent all that from happening, but I want a strong immune system. And so I never miss my weekly adjustment. Everything from your first lines of defense right here, and the mucosal tissues of the upper respiratory tract right here in the back of the throat, the nose. Studies have shown that those parts of your immune system start secreting extra after a chiropractic adjustment. Your first lines of defense, in other words. They studied AIDS patients and immunocompromised patients that were under chiropractic care. So let me read you some of the stats of the AIDS study that they've done. So they discovered that the patients, when they measured their white blood cell count, you've all heard of someone with AIDS. they lose their immune system. Somebody under chemotherapy, they lose their immune system. They're immunocompromised, right? So somebody under chiropractic care that was adjusted, they had 48% increase in the number of CD4 white blood cell counts, and that's a critical part of your immunity. And so versus the control group, the group that was not getting adjusted, their immune system, in the AIDS patients continued to decline with another 8% decrease over the span of this study. So you can clearly see that, like, chiropractic care, no matter what study you're looking at that's been done out there, you have a better immune system when you're under regular chiropractic care. And Dr. Eric, let's end with this here. We've been chatting for an hour about the importance of the human nervous system, the brain, and how the spine protects it all. My family is a testament of these numbers here that you're going to see a study at the end. You can already read it here. They've done studies on people getting adjusted on a regular basis versus people that don't. My family's a testament to that. You are now a testament to that with your incredible recovery and the lack of drug. You were on quite a few painkillers, weren't you, back when your spinal injury happened, right?
Handful of ibuprofen a day. And when I say handful, it's anywhere from 4 to 10 ibuprofen in addition to Flexerol and oxycodone I was prescribed.
Right. And that's just like a common thing that happens. Opioid addiction, opioid deaths are just like killing hundreds of thousands of people. Tylenol kills several, 1,000 people every year. Drug interactions kill so many in our country. And this study showed very clearly. You can read along with me here. You've probably already read ahead of me. Overall, a 7-year study showed that the difference between adjusted versus non-adjusted people, this is mind-blowing. 60% less hospital admissions if you're under chiropractic care. 59% less time spent in the hospital if you were admitted. So meaning you got the heck out of that hospital a lot faster if you were a regular chiropractic patient. And 52% less outpatient surgeries and procedures were performed in the group that received regular chiropractic care over the 7 years. And this is the big one, 85% less pharmaceutical drug costs to those families that were under chiropractic care. Who wants to save money? Who wants to not go bankrupt because of medical debt, which is the number one cause of bankruptcy in this country, is medical debt. And this is people that have good insurance too. If you want the best route towards living the healthiest, happiest, most cost-effective, healthcare life, include chiropractic care, bar none. That's the best advice I can give you. And then after you've taken care of that, apply all of the other 4 health essentials that will, if you don't have the other 4, down pat, once you take care of the spine and nervous system, you're still going to be robbed of your health. You're still going to develop chronic disease if those other essentials aren't applied. So to wrap up this incredible 5-part series here that, we've had the privilege of, bringing to you guys over the last 5 weeks here, that health comes. I hope you guys get the idea that health does not come from the outside in. That always leads to worse health outcomes, more drugs, more surgeries. No matter how much we try to gain health by treating symptoms, it never works. And the goal really is to get you guys to understand that health is from the inside out, not the outside in. And the roadmap to expressing your best health is through this healthcare delivery system called the 5 Essentials. And you can go back. We're going to keep these videos up so you can go back and continue to study the roadmap towards better health through these 5 Essentials. It requires a proper functioning nervous system. It requires you to get up every day and have the right mindset and keep your stress down. It requires you to feed yourself pure and simple nutrition. It requires you to get enough oxygen through proper exercise and motion. It requires you to minimize the heavy toxic burden that we're all living in today, in today's modern world. Those are the 5 key areas that are going to rob you of your health if you don't have them, if you don't practice them every day, in other words. So go back and study these 5 videos, share them with people in need. We all know a few people that are suffering unnecessarily, that are on multiple drugs, that have the warning signs of vertebral subluxation. We all know people that have had surgeries that probably could have been avoided had they had the 5 essentials in their life. We have family members that are suffering from headaches, migraines, chronic disease. We have family members and friends and coworkers that have never, ever, ever been checked by a chiropractor, ever. And just take a look at those last stats that I showed between people that get adjusted and not adjusted. You, by sharing this 5 Essentials webinar series with your loved ones, are going to have a massive, massive impact, not only on your own life, but the lives of the people you care about, whether they're right here in Grand Rapids and we can check their spines and check where their 5 essentials are at, or if you have a family member or loved one in Canada, across the US, in Europe somewhere, it doesn't matter. You can share this with them, and together, by studying and getting better at the 5 essentials, we're all going to make personally a dent in these horrific healthcare statistics that are plaguing our nation and our families today. So health is whose responsibility, Dr. Eric? Is it the medical doctor's responsibility? Is it the pharmaceutical company's responsibility to save us? Whose responsibility is to live the 5 essentials and to maintain our health?
It's my responsibility. It's your responsibility to do it for you. It's everyone watching. It's your responsibility. You've got the roadmap, and you've got the resources. Please, please, please use us. Shoot us an email if you have questions. Get us in the office. The assistants. They're not just receptionists. I know we say that all the time. They're actually health coaches. They know the 5 essentials. They're warriors in the 5 essentials. They live this way as well. They are all experts in this stuff too. So please, guys, use us as a resource, and we can help you guys really achieve the health that you want.
Yes, health is your responsibility. No one's coming to get you, as I've heard said before. No one is coming to get you. That's why the 5 Essentials Roadmap is your way out of whatever health issue you are currently experiencing, and it's the roadmap for you living your best life. So blessings to everyone who's tuned in over the last 5 weeks. If you've missed an episode, go back. You can watch it in chunks. You can watch the whole thing. They're there for you to help you live your best life. I'm Dr. Steph. Dr. Eric is with me here today, and go forth and study the 5 essentials and live your best life.
Be well, be blessed.
Yes.